May I come in?
Yes.
Okay, so good morning. So I am Deborah P. Garcia and I will be your student nurse for today. And I will be accompanying you on your cranial nerve examination. Is that okay?
Yeah, sure.
Okay, great. But before proceeding on our examination, let me just wash my hands first to avoid cross-contamination and for safety precautions. Is that okay?
Yeah.
Okay, so excuse me for a minute, miss. Now with washing of hands, let us follow the CDC guidelines. First is you have to prepare a clean towel. Now use this clean towel to open the faucet. Okay, right here. And have your hands. And then wash it. So you have to wash your hands thoroughly. Then after that, get the soap and wash your hands. So with washing with the soap, you have to rub your hands like this. And then rub at the back of your hands. And then on the other side. Next is washing the fingers one by one. Inside. Then for the knuckles, rub it against your palm. And then to the other side. And don't forget to wash your wrist. Next. And now you can rinse it with water. So with rinsing with water, you have to flex your hands lower. Rinse it thoroughly. And then next, with the use of clean towel, fold and then tap. Just tap lightly. And then again, fold. And by using this, you have to close the faucet again. And that's it. And I am back. So after washing my hands, now we will be proceeding on the examination. So before anything else, could I ask, sitting right here in front of you?
Yeah, sure.
Okay, great. So thank you. So Miss Nguho, before proceeding on our examination, let me just verify first. Okay. So what is your name?
My name is Chinkini M. Ngoho.
Okay. And then age?
I am 19 years old.
Okay. And then where do you live?
I live in Kapinya, Naval, Bulacan.
Okay, great. So nice to meeting you, Miss Ngoho. And today, we will be proceeding on checking for your vital signs. So first is we will be checking for your temperature. So I have here a thermometer. And can you have your leaves up? Okay. It's right here. And then that. Okay. And just leave that be for a minute. Okay. And while waiting, I will be putting my hands on your shoulders. Is that okay?
Yeah.
Okay. So I'll be putting that. And can I have your other hand? Okay. So let us just. Okay, thank you. And can I have that? Okay, so for this it's point 1. Okay, Miss Nuho, your heart rate is 76 beats per minute and your respiratory rate is 14 breaths per minute. And for your temperature, it was 36.1. So continuing, I will be checking for your blood pressure. So I have here the manual blood pressure, and could you please have your t-shirt up here? Okay, and then relax your arm for me. Okay. Then I will be putting the cuff. Okay, this goes right here. Okay. So, is it too tight?
No.
And this right here, is it too tight?
No.
Okay, great. So next is I will be finding for your pulse. So again, relax your arm. Okay. Right here. Okay. So your blood pressure is 102/58. So Miss Ngoho, all of your vital signs are within limits. Next, Miss Ngoho, is I will be asking some silly questions. Is that okay with you?
Yeah, sure.
Okay. So can you please state your name again?
I am Chinkimi M. Ngoho.
Okay. So what's date is today?
August 10, 2021.
Okay. And where are you now?
I'm here in Katingan, Buluran.
Okay, great. And why are you here?
I'm here for my cranial nerve examination.
Okay, perfect. And then who is the president of the Philippines?
Mr. Rodrigo Roa Duterte.
Okay, great. And next, lastly, is count backward from 15 to 1.
15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay, great. Thank you, Miss Ngoho. You've done a perfect job. So, Miss Ngoho, you're doing a great job. You are alive, alert, awake, and oriented to time, place, person, and the reason of why you are here. So proceeding with the assessment is I will be assessing for your olfactory nerve. Now, assessing for your olfactory nerve, can you please occlude your right nostril for me? Okay. And then breathe in and then out. Now, do the same thing on the opposite side. Now, for your left nostril and then in and out. Okay, thank you, Ms. Moho. So there is a complete patency of your left and right nostrils. Next, again, Ms. Nuho, could you please again occlude your right nostril for me, but this time with closing of your eyes. Okay, then I have here some substance, and please identify what kind of substance this is. Now, please identify what kind of substance this is.
A vinegar?
Oh, yes, correct. Now, Miss No, you can open now your eyes. And on the other side, do the same thing. Occlude your left nostril for me. And then again, close your eyes. And then I will be presenting the substance and identify what kind of substance this is.
A coffee?
Okay, yes, correct. So, Miss Nuho, there is perfect intactness of the left and right nostrils. So next is we will be proceeding on the assessment of your visual acuity. So I will be asking you first, do you have corrective lenses? Okay. So Miss Nuho, I am standing at a pretty distance away from you. And could you please cover your right eye? Okay. And now please read the smallest line of print you can able to read from the right to the left.
DEFPOTEC.
Okay, Miss Nuho, your left eye OS is 2020 intact. Next, again, could you please cover your left eye? Okay. And again, please read the smallest line of print from the right to the left.
DEFPOTEC.
Okay, Miss Ngoho. So your right eye is OU 2020 intact. Next, we will be now testing for your both of the eyes. Now, please again read the letters now from the left to the right.
CETOPFED.
Okay, Miss Ngoho. So your both of the eyes is OU 2020 intact. Next is I will be assessing for your 6 cardinal fields of gaze. So I want you to look straight ahead. Okay, and now I have this pen and focus and follow where the pen is heading. Okay, just go straight here and sideward and then down again and side and up, stay and then close. So thank you, Miss Ngoho. So Miss Ngoho, your left eye and right eye is both equal bilaterally. So proceeding, Miss Ngoho, I will be assessing for your oculomotor nerve. Okay, but first, let me just observe your nice and round eyes. Okay. Thank you. So your pupils are symmetrical on the left and right side. It is nice, round, and equal on both sides. Now I will shine a light on the left eye. And as you can see, there is constriction, and that is what we call direct response. Now again, I will be bringing the light back. But now, focus on the right eye. Okay, so also there is constriction, and that is what we call consensual response. Again, on the right side, I will be shining a light. And as you can see, there is constriction, and again, that is what we call direct response. Again, I will be bringing the light back, but this time, focus on the left eye. And as you can see, there is also constriction, and again, that is the consensual response. So next, Miss Ngo, is I will be assessing for your trigeminal nerve. Now, I have here a tongue depressor, and could you please move your jaws side, okay? And then push against resistance on the count of 3, okay? 1, 2, 3. Okay, now I will be doing on the other side. 1, 2, 3, go. Okay, great. So, Miss Muho, your jaws are in full range of motion. Now, Miss Muho, could you please clench your jaw? And then I will be palpating on your masseter muscles and respond now. And I mean blink if there is no pain with the palpation, okay? Okay, great. So, Miss Ngoho, there is a full range of motion of your jaws. Next is I will be assessing for your sensory function of your trigeminal nerve. Now, for this time, could you please close your eyes for me, and please respond now if you can feel the sensation of the wisp, okay? No, 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 no. Okay, great, thank you. Now, keep closing your eyes for me, okay? And now identify whether if it is dull or sharp, okay? Dull,
roll, short, roll, dull, short.
Okay, great. So, okay, thank you. You can now open up your eyes. So, Miss Nguho, you can perceive light touch and superficial pain bilaterally. Okay, next is we will be proceeding on your facial nerve. Now, could you please smile for me? Okay, now frown. Okay, now raise your eyebrows, and then show your upper teeth, and then lower teeth. Okay, now could you please purse your lips, and then close your eyes tightly. And now I will try opening them up. Okay, great. So thank you for that. So Miss Nguho, your face sensation are all intact. So the next assessment would be the taste sensation. So before proceeding with this assessment, let me just wear a glove first. Now could you please close your eyes for me? And then I have here the type of substances, and could you please stick your tongue out? Now on the tip of your tongue, so identify what type of substance this is.
Sugar,
Okay, great. Next, again, could you please stick your tongue out? And on the side of your tongue, what type of substance this is?
salt,
Okay, great. Next, could you please stick your tongue out again for me? And then I will be putting this on the anterior and identify what kind of substance this is.
salt.
Okay, great. Thank you, Miss Nguho. So your taste sensation are also intact. Next is for the assessment for your cochlear nerve, which is for the hearing. So, Miss Nguho, could you please occlude your right ear? Okay. And then I will be rubbing my fingers on the opposite of your ear. And then, can you hear that?
Yeah.
Okay, now I will be moving my fingers away from your. And can you hear that?
Yes.
Okay. So now I will be moving my fingers away from your ear, and tell me if you can no longer hear the sound, okay?
No.
Okay, great. Now we will do on the same thing on the other side. Now could you please again occlude your left ear, and then again I will rub my fingers right here, and can you hear the sound?
Yes.
Okay, great. And again I will be moving my fingers away from your ear, and tell me when you can no longer hear the sound, okay?
No.
Okay, great. So, Miss Nguho, you can hear everything properly on the left and right side of your ear without the signs of deafness and decreased auditory acuity. Now we will be proceeding on the Weber test. Now for the Weber test, I will have here a tuning fork. I have here the tuning fork, and I will be placing this on the top of your forehead. Please respond now if you can hear on the both sides of your ear or in just one side of your ear, okay? So let me just do this.
I can hear the equal sides of my tongue.
Okay, great. So Miss Nguho, there is no lateralization of the sound on both of your left ear and right ear, which is good. Now we can now exclude the Rene test, but if you want to be more thorough, we can still proceed on the Rene test. So would you want to proceed?
Yes.
Okay, great. So now we will be performing for the Rene test. I will be placing this tuning fork at your ears, in front of your ear, and then at the back of your ear. Now, and also, please respond now if you can hear the vibration, okay?
Yeah.
Okay. other side?
No.
Okay. Okay. So, Miss Ngohot, your air conduction is greater than your bone conduction, which is normal. So now we will be proceeding on the assessment of the past pointing fingers. So I want you to flex your arm for me and then present a 2-point finger, okay? And I will also be having my fingers just beneath yours. And then could you please move your arm upward? Okay, now back. Okay, so could you please do this 2 times, but now with closing of your eyes. Upward and back. Again, upward and back. Okay, thank you. So the vestibular portion of your vestibular cochlear nerve is intact. Now we will be proceeding on another test, which is the Rumberge test. Now for the Rumberge test, could you please stand for me? Okay. And then have your feet close together, okay? Now, could you please close your eyes for 3 seconds? Okay. Okay, thank you, Miss Ngoho. So you can now sit down.
Thank you.
Now for the next assessment is, could you please cough for me? Swallow. And then say, Maintain. Okay, thank you. So next is, again, could you please open your mouth for me? And now I will be touching slightly your posterior pharyngeal wall. Okay? Oh, I'm sorry for that. And so, Miss Ngoho, your elevation and constriction of your pharyngeal musculature and the elevation of your tongue indicates positive gag reflex. Next, Miss Ngo, is I will be standing and I will be positioning myself at your back and have my hands here with pressure. And can you please shrug your shoulders upward and resist against resistance with the count of 3, okay?
Yes.
1, 2, 3, resist. Again. 1, 2, 3, resist. Okay. Next is this time, could you please have your head this way, okay? And I will be palpating on your sternocleidomastoid right here. And is there any tenderness with that?
No.
Okay, great. And next is have your head push against resistance with this hand, okay?
Yeah.
Then on the count of 3, 1, 2, 3, resist. And then we will be doing on the same thing on the opposite side. Touching here. Then 1, 2, 3, resist. Okay, great. So again, is there any tenderness with the palpation on this side?
No, no.
Okay, great. So there is full range of motion of your neck. So next is, could you please repeat after me? D, D, L, L, N, and T.
T.
And these phrases: delineate,
Delineate.
delicate,
Delicate.
liberate,
Liberate.
nanometer,
Nanometer.
and rake. Okay, great. So, Miss Ngoho, your ability to articulate letters and phrases are intact. So next, Miss Ngoho, could you please stick your tongue out and then move side to side from this and this. Okay, that. And now have your tongue push against your cheek like this. Okay, and resist against resistance on a count of 3. 1, 2, 3, go. 1, 2. Okay, this side. 1, 2, 3, resist. Okay, thank you. So, Miss Ngoho, you are able to protrude your tongue medially, and also there is normal strength on your tongue, and there is no atrophy, lesions, or tumors. So now I will be testing for your sensory function, and I will be wisping the cotton on your upper and lower extremities, and again, Please respond now if you can feel the sensation, okay? Okay. And again, close your eyes. Okay. No. 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 And keep closing your eyes, and now please identify whether if it is sharp or dull. Sharp, dull, sharp, dull, sharp, dull, sharp, dull, sharp, dull, sharp. Okay, you can now open your eyes. And now for the vibration sensation is I have a tuning fork here, and I will be placing this tuning fork at the top of your finger joint and your two joint. Now, let me just bend it here and now for the two joint. Again, please respond now if you can feel the vibration.
No.
Okay, great. So, Miss Moho, your cutaneous skin is intact. Your sharp and dull pain is also intact. And for your vibratory sensation, it is intact bilaterally on the lower and upper extremities. So, Miss Moho, now we will be proceeding on the assessment on the deep tendon reflex. Now, we will be starting with your brachioradialis. So, muduol pa. Now, for the biceps, can I have your arm and then flex? So, this cord-like right thing here is the tendon, and then relax. And then I will do. Okay. Now for the triceps, can you please move your body to this side? Again, and can I please have your arm? Then like, and this right here is the tendon, and then support, and then okay. For the Achilles, can you please remove your sandals? Okay, and have your this right here and dorsiflex. Okay, this right here is the Achilles, and let us press it lightly. And proceeding is for the plantar, and then flex this, and this have this. Okay, again. So that would be all for today for your cranial nerve examination, and thank you, Ms. Moho, for trusting and cooperating with the whole exam. Again, thank you.